1. A nurse is caring for 4 patients. Which patient should the nurse assess first, based on the principle of patient safety and clinical urgency? 1. A patient with asthma requesting a bronchodilator. 2. A patient with a new onset of confusion and slurred speech. 3. A post-operative patient requesting pain medication. For a patient with a dressing change scheduled. Answer. The nurse should assess the patient with new onset of confusion and slurred speech first. Rationale. New confusion and slurred speech may indicate a stroke or other neurological emergency, requiring immediate intervention to prevent permanent damage. 2. A nurse is assigning tasks to a UAP, unlicensed assistive personnel. Which task is appropriate for the nurse to delegate? 1. Administering oral medications. 2. Performing sterile dressing change. 3. Measuring and documenting vital signs. 4. Teaching a patient about insulin administration. Answer. The nurse should delegate measuring and documenting vital signs to the UAP. Rationale. Measuring and recording vital signs is within the scope of practice for a UAP, while medication administration, sterile procedures, and patient teaching require a licensed nurse. 3. A nurse on a medical surgical unit receives reports on 4 patients. Which patient should the nurse assess first? 1. A patient with diabetes reporting hunger and shakiness. 2. A patient scheduled for discharge. 3. A patient with chronic back pain requesting medication. 4. A patient waiting for wound care. Answer. The nurse should assess the patient with diabetes reporting hunger and shakiness first. Rationale. Symptoms of hunger and shakiness in a diabetic patient indicate possible hypoglycemia, which is a life-threatening condition needing immediate treatment. For a charge nurse observes a newly hired nurse inserting a Foley catheter without using sterile gloves. What is the appropriate action by the charge nurse? 1. Immediately stop the procedure and reinforce sterile technique. 2. Allow the procedure to continue and correct later. 3. Report to the nurse manager immediately. 4. Document the error in the patient's chart. Answer. The charge nurse should immediately stop the procedure and reinforce sterile technique. Rationale. Maintaining sterility during invasive procedures is essential for patient safety and infection prevention. Immediate correction is necessary. 5. A nurse is caring for a patient on fall precautions. Which intervention should the nurse implement to promote safety? 1. Keep the bed in a high position. 2. Remove the call light to reduce clutter. 3. Place a non-slip mat next to the bed. 4. Encourage the patient to ambulate alone. Answer. The nurse should place a non-slip mat next to the bed. Rationale. A non-slip mat helps prevent falls by providing a stable surface, aligning with fall precaution protocols to ensure patient safety. 6. A nurse working in a long-term care facility assigns tasks to a UAP. Which task should not be delegated? 1. Assisting with bathing. 2. Feeding a stable patient. 3. Monitoring for signs of aspiration. 4. Obtaining vital signs. Answer. The nurse should not delegate monitoring for signs of aspiration to the UAP. Rationale. Monitoring for clinical changes, such as aspiration, requires nursing judgment and cannot be delegated to UAPs. 7. A nurse is caring for a patient with COPD who becomes increasingly short of breath. What is the priority nursing action? 1. Increase oxygen to 6 liters per minute. 2. Notify the healthcare provider. 3. Encourage pursed lip breathing. 4. Assist the patient to a supine position. Answer. The nurse should encourage pursed lip breathing. Rationale. Pursed lip breathing helps control respiratory rate, improve gas exchange, and reduce dyspnea in COPD patients. 8. A nurse finds an elderly patient on the floor after a fall. What is the nurse's priority action? 1. Move the patient to bed immediately. 2. Assess for injuries and check vital signs. 3. Notify the family. 4. Document the fall. Answer. The nurse should assess for injuries and check vital signs. Rationale. Safety and assessment are the priority to identify injuries or complications before moving the patient or notifying others. 9. A nurse is planning care for 4 patients. Which task is most appropriate to delegate to an experienced LPN? 1. Initial patient assessment. 2. Administering 4 push medications. 3. Reinforcing teaching about medication side effects. 4. Developing the care plan. Answer. The nurse should delegate reinforcing teaching about medication side effects to the LPN. Rationale. LPNs can reinforce teaching, but initial assessments for push meds and care plan development require RN judgment. 10. A nurse enters a room and finds a patient with a tracheostomy, coughing, and unable to speak. What is the nurse's priority action? 1. Notify the respiratory therapist. 2. Provide oral suctioning. 3. Suction the tracheostomy. 4. Encourage the patient to drink fluids. Answer. The nurse should suction the tracheostomy. Rationale. A tracheostomy patient with ineffective airway clearance requires immediate suctioning to maintain a patent airway. 11. A nurse observes a student nurse preparing to administer insulin without checking the patient's blood glucose. What should the nurse do? 1. Allow the student to proceed. 2. Remind the student to check the blood glucose first. 3. Report the student to the school immediately. 4. Administer the insulin herself. Answer. The nurse should remind the student to check the blood glucose first. Rationale. Checking blood glucose prior to insulin administration is a safety measure to prevent hypoglycemia and must be reinforced. 12. A patient with heart failure reports a 3-pound weight gain in 24 hours. What should the nurse do first? 1. Administer a diuretic. 2. Notify the provider. 3. Assess lung sounds and vital signs. 4. Restrict fluid intake immediately. Answer. The nurse should assess lung sounds and vital signs. Rationale. Assessing for fluid overload signs guides further intervention and ensures patient safety before medication administration. 13. A nurse is delegating to a UAP. Which of the following tasks is safe to assign? 1. Ambulating a stable post-op patient. 2. Administering oral medications. 3. Assessing surgical incision. 4. Changing a sterile dressing. Answer. The nurse should assign ambulating a stable post-op patient. Rationale. UAPs can safely ambulate stable patients, while other tasks require nursing assessment and skills. 14. A nurse caring for a confused patient sees the patient attempting to get out of bed without assistance. What is the priority action? 1. Restrain the patient. 2. Offer to assist the patient to the bathroom. 3. Call the family to stay with the patient. 4. Activate the bed alarm. Answer. The nurse should offer to assist the patient to the bathroom. Rationale. Addressing the patient's need while preventing injury promotes safety without unnecessary restraints. 15. A patient with a history of seizures begins to have a seizure in bed. What is the nurse's priority action? 1. Restrain the patient's arms and legs. 2. Place a tongue blade in the patient's mouth. 3. Turn the patient to the side and protect the head. 4. Leave the room to get help. Answer. The nurse should turn the patient to the side and protect the head. Rationale. Turning the patient prevents aspiration, and protecting the head prevents injury during a seizure. 16. A nurse is caring for a patient with a central line. Which action requires immediate intervention? 1. Scrubbing the hub before access. 2. Changing the dressing using sterile technique. 3. Flushing the line with sterile saline. 4. Leaving the cap off after disconnection. Answer. The nurse should intervene immediately if the cap is left off after disconnection. Rationale. Leaving the cap off a central line increases the risk of infection and air embolism. It must be capped or clamped. 17. A nurse finds a fire in the utility room. What is the nurse's first action following the RACE acronym? 1. Activate the fire alarm. 2. Confine the fire. 3. Evacuate the area. 4. Rescue patients in immediate danger. Answer. The nurse should rescue patients in immediate danger first. Rationale. According to the RACE protocol, rescue, alarm, confine, extinguish. Rescuing those in immediate danger is the priority. 18. A nurse is supervising a UAP who is ambulating a post-operative patient for the first time. What should the nurse do? 1. Allow the UAP to ambulate independently. 2. Supervise the ambulation closely. 3. Reassign the task to an RN. 4. Delegate the task without supervision. Answer. The nurse should supervise the ambulation closely. Rationale. Initial ambulation post-surgery carries risk. The nurse must ensure patient safety through supervision. 19. A nurse is caring for a confused patient who keeps pulling at the 4 line. What is the most appropriate intervention? 1. Apply soft mitt restraints. 2. Remove the 4 line. 3. Place the patient in a dark room. 4. Ignore the behavior. Answer. The nurse should apply soft mitt restraints. Rationale. Soft mitt restraints prevent line removal while maintaining patient safety and dignity as a last resort. 20. A nurse enters a patient's room and notices the infusion pump is alarming due to occlusion. What is the nurse's first action? 1. Silence the alarm without action. 2. Check the 4 site and tubing for obstruction. 3. Replace the 4 pump. 4. Notify the physician immediately. Answer. The nurse should check the 4 site and tubing for obstruction. Rationale. Assessing the cause of the occlusion ensures safe and appropriate management of IV therapy before further intervention. 21. A nurse is caring for a patient with a chest tube. The nurse notices continuous bubbling in the water seal chamber. What is the nurse's priority action? Answer. Check for an air leak in the system. Rationale. Continuous bubbling indicates a possible air leak, which must be identified and corrected to maintain effective lung re-expansion. 22. A nurse is preparing to administer medications via a nasogastric tube. What should the nurse do first? Answer. Verify tube placement. Rationale. Verifying placement prevents complications like aspiration and ensures medications are delivered properly into the stomach. 23. A patient receiving blood transfusion reports chills, back pain, and fever. What is the nurse's immediate action? Answer. Stop the transfusion immediately. Rationale. These are signs of a transfusion reaction, requiring immediate discontinuation to prevent further complications. 24. A nurse finds a diabetic patient unconscious with cold, clammy skin. What is the nurse's first action? Answer. Administer glucose or glucagon. Rationale. The signs suggest hypoglycemia, which requires rapid correction with glucose to prevent brain injury. 25. A nurse is caring for a patient on contact precautions. Which action by a UAP requires intervention? Answer. Leaving the room wearing gloves only without removing gown. Rationale. Proper removal of PPE prevents the spread of infection. Gown and gloves must be removed before leaving the room. 26. A patient with newly diagnosed hypertension asks why multiple BP readings are taken. What is the best nurse response? Answer. To ensure accuracy, because blood pressure can vary throughout the day. Rationale. Explaining that multiple readings prevent misdiagnosis and promote accurate treatment reflects patient education and safety. 27. A nurse is caring for a patient with Clostridium difficile, C. diff. Which infection control measure is most important? Answer. Hand washing with soap and water. Rationale. Alcohol-based sanitizers are ineffective against C. diff spores. Hand washing physically removes them. 28. A nurse is planning care for a patient with dysphagia. What intervention promotes safe swallowing? Answer. Position the patient upright at 90 degrees during meals. Rationale. Upright positioning reduces the risk of aspiration and promotes safe swallowing. 29. A nurse notices the UAP is transferring a weak patient without a gait belt. What is the nurse's appropriate action? Answer. Stop the transfer and provide the gait belt. Rationale. Safety devices like gait belts prevent falls and should be used when transferring weak patients. 30. A nurse is teaching a patient about warfarin therapy. What statement indicates a need for further teaching? Answer. I will increase my intake of green leafy vegetables. Rationale. Green leafy vegetables are high in vitamin K, which interferes with warfarin effectiveness. 31. A nurse is delegating care to a UAP. Which patient should the nurse not assign to the UAP? 1. Stable patient needing vitals. 2. Patient needing assistance with ambulation. 3. Patient requiring post-mortem care. 4. Patient requiring bladder scan for retention. Answer. Patient requiring bladder scan for retention. Rationale. Bladder scanning requires assessment and interpretation, which is within the RN or LPN scope, not UAP. 32. A nurse observes smoke coming from a patient's oxygen tubing. What is the nurse's immediate action? Answer. Remove the oxygen source. Rationale. Oxygen supports combustion. Removing it immediately reduces the risk of fire spreading. 33. A nurse is caring for a patient with tuberculosis TB. What type of isolation is required? Answer. Airborne precautions with N95 mask. Rationale. TB is transmitted via airborne particles, requiring specialized precautions to prevent spread. 34. A patient with fluid volume overload has edema and crackles in the lungs. What is the nurse's priority action? Answer. Elevate the head of the bed. Rationale. Elevating the head improves oxygenation and reduces respiratory distress in fluid overload. 35. A nurse enters a room and sees the patient experiencing shortness of breath while lying flat. What should the nurse do first? Answer. Assist the patient to a sitting position. Rationale. Sitting up helps relieve dyspnea by improving lung expansion and decreasing work of breathing. 36. A nurse is preparing to administer potassium chloride for. What is a critical safety check? Answer. Ensure potassium is diluted and infused via pump. Rationale. Undiluted potassium 4 can cause fatal cardiac arrhythmias. Infusion must be controlled and monitored. 37. A nurse is reviewing lab results. Which findings should be reported immediately? 1. Potassium 3.5 milliequivalent/L2. Sodium 135 milliequivalent/L3. Potassium 6.2 milliequivalent/L4. Calcium 9.5 milligrams per deciliter. Answer. Potassium 6.2 milliequivalent/L. Rationale. Hyperkalemia, K plus greater than 5.0, can cause life-threatening cardiac dysrhythmias and requires urgent intervention. 38. A nurse receives a new order for 2 units of blood for a patient with anemia. What is the nurse's priority before administration? Answer. Verify patient identity and blood compatibility. Rationale. Blood verification prevents transfusion reactions due to mismatched blood products. 39. A nurse is caring for a confused patient who frequently gets out of bed. What is the best fall prevention strategy? Answer. Place the patient near the nurse's station. Rationale. Increased observation and frequent checks near the nurse's station promotes safety without restraints. 40. A nurse notices a post-operative patient's wound is separating with visible organs. What is the priority action? Answer. Cover the wound with sterile saline moistened gauze. Rationale. Evisceration is a surgical emergency. Covering with moist sterile gauze prevents tissue drying and infection until surgery. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.